Good morning and welcome to today's webinar on food nutrition policy. My name is Avenel Joseph and I am Vice President of Policy at the Robert Wood Johnson Foundation, the nation's largest philanthropy dedicated solely to health. The foundation has been active for more than 50 years and is a trusted and nonpartisan source of information on policy that enhances health and the effectiveness of the healthcare system. Today's conversation will focus on SNAP and other food nutrition programs in the United States. We will discuss upcoming changes to these programs and what these changes may mean for your constituents, especially those living in underserved communities. SNAP, WIC, and other programs cover nearly 50 million people in the United States and are vital for augmenting low-income families' purchasing power. Substantial evidence shows that food and nutrition policy programs improve lives, reduce food insecurity and poverty, and help alleviate health disparities. The COVID-19 pandemic amplified a growing financial equity gap across the country. As food prices and access change the effectiveness of any given program, especially for people of color or those in low-wage jobs. To discuss this, I am pleased to introduce Megan Lott, Deputy Director of Healthy Eating Research, or HER, located at Duke University. Healthy Eating Research is a national program of the Robert Wood Johnson Foundation focused on identifying strategies to improve children's nutrition and prevent childhood obesity. Without further ado, I want to turn it over to Megan.
Thanks so much, Avenel, and it's great to be here with you all this morning. I have been with Healthy Eating Research for about 7 years. My background is in public health and nutrition. I'm a registered dietitian, and I've had the opportunity to work on many of these programs, both when I first started out working at a local food bank and then working in DC for 7 years on national and state policy, and now here at Duke on the research end. So I hope today I'll be able to give you some comments that really address the intersection of practice, policy, and research in a way that's really helpful as well. And as Avenel said, we're really funded by the Robert Wood Johnson Foundation to identify what are some of the most timely policy relevant research gaps in these areas, fund those studies, and then communicate findings with decision makers to hopefully have a policy impact. For today's presentation, I'm really going to focus on 3 critical nutrition assistance programs: WIC, school meals, and SNAP. And just to set a little bit of background context on the next slide, estimates from March to April 2020 show that US food insecurity doubled overall and tripled among households with children as the nation shut down and many families lost sources of income due to the COVID-19 pandemic. Similarly, recent data from the Centers for Disease Control and Prevention reported an increase in overweight and obesity among children aged 2 to 19 years during the pandemic, as more children spent time at home, away from physical activity opportunities that they were otherwise getting at school or childcare, and away from those healthy meals that were provided. Throughout the pandemic, the federal response has served as a first line of defense against food and nutrition insecurity for millions of families with children, or with low incomes and with children. On the next slide, I'll start by going into WIC. So just a brief overview of the program for those of you who are less familiar. The Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC, really serves women who are pregnant, postpartum, or lactating, infants, and young children up to age 5 who are at nutritional risk and living in or near poverty. Each of the federal programs we're going to talk about today define that poverty level a little differently. WIC defines their income eligibility as less than or equal to 185% of federal poverty. For a family of 4 to meet these income eligibility requirements, that really translates to a combined annual income of about $49,000 or less. So not a lot for a family of 4. There are 2 major types of nutrition risk recognized for WIC eligibility. The first are medically based risks, such as anemia, underweight, history of pregnancy complications, and/or poor pregnancy outcomes. And the second are dietary risks, such as inappropriate nutrition or feeding practices, or the inability to meet the dietary guidelines for Americans. WIC serves roughly half of all infants born in the United States, which is really a large number. On average, that translates to about 6.2 million people participating in the WIC program each month during the year of 2020. And the WIC program and the school meal programs, which I will talk about next, are authorized through the Child Nutrition and WIC Reauthorization Act, which is typically reauthorized by Congress every 5 years. Although it was last reviewed in 2010, we're hoping that the next Child Nutrition Reauthorization will take place in 2022. So WIC is administered at the federal level and provides funding to states, Indian tribal organizations, the District of Columbia, and 5 territories. WIC services are then provided at the local level through health departments, hospitals, schools, Indian health service facilities, et cetera. And these services really include providing nutritious foods to supplement participants' diets like eggs, milk, whole wheat bread, fruits and vegetables, baby foods, and iron fortified infant formula. But they also include breastfeeding support and counseling, health screening, and nutrition education. Next, please. We have a lot of data to show that there are some really significant benefits of the WIC program. A couple of them are listed here on the slide. So improvements in infant and child health outcomes, improved diet quality and diet-related outcomes for participants, improved short-term cognitive development, which ultimately sets children up for better academic performance when they do reach school age, increased access to healthcare and other social services, and increased rates of breastfeeding among WIC participants. One other thing I think is really important to point out is that with infant mortality and maternal mortality being really important issues, especially for women of color, participation in the WIC program has really helped with a lot of those birth outcomes as well. Also important to note is that the WIC program has benefits for even non-participants. So for example, strong stocking standards for WIC authorized retailers ensure that nutritious foods that are included in the WIC food package are available in neighborhood food environments and really increase healthy food access for all consumers, regardless of whether they participate in the program. So if you have a local corner store in your neighborhood that is a WIC authorized retailer, they're going to have a higher variety of healthy food options available than other corner stores might in the area. Next. As I mentioned, we have seen a lot of impacts of COVID on these programs. So despite the significant need for food assistance during COVID-19, WIC participants faced many barriers to accessing WIC services and redeeming benefits. And a few of the most commonly reported challenges include difficulty accessing in-person appointments required for participant certification and recertification, limited availability of WIC-approved food items at retail food stores due to nationwide supply chain issues, and inability to purchase groceries online with WIC benefits due to federal policy requirements. And as we all know, online grocery shopping became really important during the pandemic. Thankfully, in response to many of these challenges, the Families First Coronavirus Response Act authorized USDA to approve waivers that would ensure access to WIC services and benefits, and these have been really successful. So some examples of these waivers include the physical presence waiver, which allowed WIC agencies to do recertification and enrollment via phone or virtually through video appointment, the remote benefit issuance waiver, which removed the requirement for participants to actually come to the WIC clinic to pick up their benefits, extended benefits issuance waiver, which allowed WIC participants to continue to receive important services and benefits without having to physically go into the clinic, as well as the minimum stock waiver and the food package substitution waiver, which really allowed retailers and participants flexibility in stocking and purchasing WIC approved foods if the availability was limited in the retail food store. So for example, WIC is very specific. For some packages, it'll say you can buy this bread in this exact ounce size or package size. And the store might have not had that package size. They allowed you to then substitute for a slightly larger or smaller package size as necessary. Next, please. So one of the things healthy eating research did during the early response to the pandemic, recognizing how important federal nutrition programs were, we funded a series of studies that really looked at a lot of the waivers put in place and how programs were operating to both identify short-term solutions and longer-term opportunities to really improve program operations. And we identified through several of those studies some policy opportunities for future improvements. So one, our data is really showing from some initial studies we ran in New York City and Washington State that maintaining USDA waivers for physical presence requirements and allowing remote services permanently would be a huge improvement to the WIC program. To improve these visits and enhance program retention, further research is needed to identify the effectiveness of virtual visits for things like nutrition education, as well as the appropriate frequency and visit types. But what our early data is showing us that allowing these physical presence waivers reduced the program dropout rate by more than 45%, which is very significant. Second, allowing WIC participants to shop and purchase groceries online using WIC benefits would really ensure an equitable experience for WIC participants. It will be important to study the uptake of online shopping to identify barriers to use among certain vendors or participants, especially with smaller vendors and WIC retailers. We know that online shopping technology might require a little bit more support or technical assistance, but especially for WIC families with young children, allowing them to do this online grocery shopping addresses several barriers, not only reducing risk of disease transmission during the pandemic, but also transportation issues, childcare issues, and limited time issues. And finally, the third one is really providing additional investments to modernize and advance current technologies to support long-term implementation and success of WIC remote services and online ordering. WIC is a program that over the years hasn't had as much investment in the technology aspect. So there was some money dedicated to that prior to COVID. But when you look at how WIC might compare technologically to other programs, nonprofit, for-profit, regardless across the nation, they're really 20 years behind. When shifting to remote services, a big barrier initially was that many WIC staff only had desktop computers, or they were still using paper records. So they didn't quite have the ability to just take a laptop home and start working remotely in the same way many of us did. And really allowing more investments in that technological support to modernize WIC would be really important. Next, I'm going to move on and give you a brief overview of the school meal programs, which really touches on the National School Breakfast and Lunch programs and the Summer Food Service Program. So the National School Breakfast and Lunch programs are administered by the United States Department of Agriculture, and they're cornerstone of the nation's nutrition safety net for children from low-income families. 95% of U.S. public schools participate in the National School Lunch Program, providing lunches to more than 30 million children in an average day. And of these, 21.5 million are children from low-income families. These numbers have shifted a bit. This is pre-pandemic data. So in many cases, we're seeing even more schools now participating in school meals than prior to the pandemic. In 2019, 14.7 million children from low-income families participated in the National School Breakfast Program, and 80% were free and another 5% were provided at a reduced price. So again, really large reach of these programs. And then finally, the USDA Child Nutrition Summer Feeding Programs reached 2.7 million children in 2019. There are more barriers to participating in the Summer Food Service Program, including transportation and location of meal sites. However, there have been some really wonderful innovations during COVID that we hope will again be allowed to continue permanently, that will really have an opportunity to really enhance program participation and reach. Next, please. So research shows that receiving free or reduced price school lunches reduces food insecurity, obesity rates, and poor health. In addition, the school meal nutrition standards, which were updated in 2012 as a result of the Healthy Hunger Free Kids Act passed in 2010, have significantly improved the nutritional quality of meals served and the diet quality of participants. In fact, school meals are healthier than lunches packed from home. And we actually had a special journal issue in the journal Nutrients come out in early 2020, 2021 that really looks at data from the school nutrition meal cost study and the past, it was pre-pandemic, but since the standards were updated in 2012, that really expounds on all of these program impacts and benefits on the slide before you, and would encourage you to take another look if you're really interested. Next. So just like WIC, there have been some challenges during the COVID-19 pandemic. First and foremost, access to school meal programs was disrupted by the sudden school closures in spring of 2020, and many lasted well into 2021 across the country. As I mentioned, the 2010 Healthy Hunger Free Kids Act made significant contributions to improving nutrition standards and actually to closing the nutrition disparity gap for school-age children across the United States. But unfortunately, the pandemic has really exacerbated health disparities, again, particularly for households with children. And so we've seen food insecurity, for example, increase among households with children, disproportionately affecting children of color, and inequitable access to meal distribution sites did little to mitigate this. School communities quickly mobilized to ensure kids still had access to daily meals. However, there were significant challenges presented. For example, protecting the health and safety of workers who were preparing and distributing meals. Staff were also overburdened and concerned about their own health during uncertain times. I will say we saw, school food programs really, without hesitation, go right to the front lines early in the pandemic. For them, they were thinking first and foremost, how do we get these kids the meals they need? And many of them did put their own health and safety at risk early in the pandemic because we didn't know a lot. We didn't know about, we were saying require masks, but beyond that, we didn't know how the disease was transmitted exactly, or in as much detail as we do now, and where the risks truly are or aren't. And a lot of them jumped right in without question with kids' health at their forefront. Lower participation in school meal programs has also created a financially unsustainable situation where schools were forced to bear more costs than they could make up in revenue. And that had a lot to do, as I mentioned, with not all kids being able to access school meals at the different distribution sites. And then finally, supply chain issues and limited resources and equipment jeopardize the nutritional quality of school meals. And unfortunately, we're still facing some of those supply chain issues today. In response, USDA approved numerous waivers to make it easier for schools to provide meals to children. Meals were allowed to be served to kids outside traditional times to maximize flexibility for meal pickup. Parents or guardians could pick up meals sometimes several days at a time and bring them home. And schools were allowed to follow more lenient nutrition standards and operation requirements given those supply chain disruptions. And finally, school districts were allowed to provide meals to all kids at no cost. So regardless if they were 2 years old or 10 years old, they were still allowed to receive free meals under the school meal program. Next, please. So a couple of policy opportunities we've identified through the research we've done and through working with partners. The first is to really expand free meals through universal free meal programs or community eligibility provision, a meal service option that became available nationwide starting in school year 2014 to 2015, and allows schools located in high poverty areas to serve universal free breakfast and lunch. There are many benefits to expanding these universal free meal options. The second is really to increase access to meals during summer and future pandemics. So I mentioned earlier that one of the challenges with summer meals is that they are really only located in specific sites. There can be transportation issues, but some really unique opportunities in response to school closures. Pandemic EBT provided emergency nutrition benefits loaded on an EBT card for school children who were eligible to receive free or reduced price meals. So it didn't matter if they were near a site or not, their families still had those additional resources. And additionally, several waivers were created for the summer food service program, which made it easier to participate in the program, including allowing grab and go meals, again, serving free meals to children in all areas, not just those where at least half of the students receive free or reduced price meals. And then consider expanding some of these strategies beyond the pandemic to broadly increase nutrition security among children is really important to allow increased access to summer meals in future years as well. Third, updating the financial model. So currently school meal programs function on a restaurant style financial model, and students must redeem meals for schools to be reimbursed. So regardless if as a school cafeteria, I might prepare 100 meals. So I've already incurred the cost for 100 meals, but let's say that day only 80 students get the meal, I only get reimbursed for 80. So I have to kind of figure out a way to cover the cost for those other 20 meals I've already produced, and that's a sunk cost. So really considering updating that financial model for school meal programs. So these programs function like other federal food assistance programs, such as WIC, which does not require individual WIC agencies to operate their budgets based on how many families fully redeem their WIC benefits, would really enhance the financial security of school food service. And then finally, aligning the nutrition standards for all school meals with the most recent dietary guidelines. We know that nutrition standards required by the Healthy Hunger Free Kids Act have significantly improved the nutritional quality of school meals and the diet quality of school-age kids. So we really think it's critical to maintain and update the nutrition standards to improve the health of school-age children. And as I mentioned, there were several waivers put in place during the pandemic because of supply chain issues, where we kind of reverted backwards a little bit on school nutrition standards. And recognizing those supply chain issues are still present today, a lot of those waivers are in place. However, we also feel it's really important to move back to the improved school meal nutrition standards as soon as possible, especially given the research we have just showing how much it's really benefit students in multiple areas, from academic performance to nutrition and diet quality to overweight and obesity as well. Next, please. Finally, I'm going to briefly touch on the SNAP program. So the Supplemental Nutrition Assistance Program, or SNAP, provides nutrition assistance to low-income households who meet eligibility requirements. And in this case, as the household annual income has to be 130% of the US federal poverty level, which translates to a gross monthly income of about $2,871 or less for a family of 4. SNAP provides households with a monetary electronic benefit transfer card that can be used to purchase groceries at authorized stores. Unlike WIC, there are not nutrition standards for items that can be purchased. Individuals apply directly through their state agency, and benefits are determined using income and certain expenses. So SNAP is reauthorized as part of the Farm Bill, which is approved by Congress about every 5 years. The most recent Farm Bill was in 2018 and expires on September 30th, 2023. So we expect deliberations on the next Farm Bill will begin in 2022. Next, please. Again, there are many benefits of SNAP participation. A couple to highlight here is SNAP has really been shown to stabilize the economy, especially in times of economic recession. It has definitely been shown to reduce food insecurity, reduce healthcare expenditures, reduce poverty, and improve health outcomes. And again, we have a brief that we put out in summer of 2020 that really expounds on the evidence-based program impacts of SNAP across all of these areas, and would encourage you to take a look at that for additional reading. Next, please. Despite the significant need for food assistance during the COVID-19 pandemic, SNAP participants also faced many barriers early on to accessing and redeeming benefits. One effort that took effect immediately was the ability for retailers to accept SNAP benefits for online purchases in 47 states and DC. But that also took some time. That waiver went into place right away, but it took retailers some time to actually be ready to address that need. So in some cases, there was up to a 6-month delay before you could actually get or do online orders in different states. And online purchasing is still not available in all areas of approved states. The benefits do not cover delivery costs, and gaps remain in rural areas. So there are definitely some barriers to continue addressing. Other challenges included overburdened administrative staff and agency systems due to increase in SNAP applications and reduced staff capacity. Some SNAP participants still have no or limited access to broadband services and digital devices required to access services and or order groceries online. So again, in response to these challenges, USDA authorized flexibilities and waivers, some of which, waiving initial and recertification interviews, extending certification periods, and allowing the state to document in writing that a client verbally confirms information on the application instead of requiring an audio recording were really important. Next, please. And again, through the research we funded and work with our partners, we've identified additional recommendations or opportunities for future improvements. So first, additional administrative funding is needed to help state agencies modernize their IT infrastructure. This would really help states update eligibility systems and customer portals, increasing availability of online purchasing, building mobile-friendly applications, and expanding mobile and virtual EBT access. Second, expanding program access to underserved populations by improving access to broadband services in rural areas and tribal nations. And third, ensuring benefit sufficiency of SNAP participants. So in August 2021, USDA released an updated Thrifty food plan, expanding the buying power of SNAP recipients to reflect changes in the affordability of foods and consumers' lifestyles. And future policy should ensure the benefits are sufficient for all SNAP participants, as an early study suggests that the benefit still falls short in certain counties. And I believe it's about 20% of counties around the country. This still won't be quite enough for families to meet the dietary requirements or dietary guidelines for Americans. Next. So that concludes my brief, rapid overview. I know that was a lot of information in a very short period of time, but I do hope that is helpful, and I think we still have some time for questions.
We do. Thank you so much, Megan. That was jam-packed with really useful information. So we're going to transition now to the part of this briefing where we'll take questions from the audience. To ask a question, you can click the Raise My Hand button at the bottom of your screen. For those who are joining by phone, you can select *9 and we'll call on you in the same manner. We did have a couple of pre-submitted questions, so I am going to start with those, but feel free, audience, to jump in at any time. Megan, if you could talk a little bit more about SNAP eligibility. You spoke about the 130% FPL that they have to meet, which amounts to a little more than $33,000 a year for a family of 4, which is certainly not a lot of money to balance all of the expenses of a family of 4. How many more people would be eligible for SNAP if the able-bodied adults without dependents work requirement and time limit was dropped?
So I probably can't give you exact numbers on how many more people would be eligible with those requirements dropped, but what I can expound upon a little bit more is around the eligibility and the current number of families or percentage breakdown of who's receiving SNAP. So with SNAP program as it is now, about 2/3 of all participants are families with children. Most adults are working. Another 1/3 are mostly senior citizens who are retirement age and so who aren't working but are living on a fixed income. So that is the current SNAP makeup. And we do know that the ABOD requirement or able body without dependence requirement and the time limit requirement do limit a number of individuals who may not have children and or you might be pursuing advanced degrees in education, for example, but living again on fixed incomes or living without meeting a minimum wage standard for expenses. That really leaves them ineligible for the program and so has them relying on programs like food banks for supplemental income. So I'd have to go back and look at the exact numbers, but these are 2 groups in particular, especially looking at, being at a university, looking at graduate students who may have their education funded, but they don't get money for living expenses in the same way that undergraduates do. We have a campus food pantry where we are serving a lot of people each month who don't qualify for SNAP because they're full-time students, but who could really significantly benefit from this additional program.
Thanks, Megan. And how can Congress enhance SNAP's nutrition quality? Could you talk a little more about that?
Yes, definitely. So we had a report that we put out actually just a couple of months ago this summer, really looking at how to increase the public health impacts of SNAP through the next Farm Bill, although it also identifies opportunities in the more near future over the next 2 years as well. And nutrition quality was a big focus area of that report. So the first is really increasing access to the program as well as the adequacy of the program. So I mentioned that enhancement to the Thrifty food plan is so significant. It's the first time this has happened in decades. And we know that giving people more money will allow them to purchase healthier foods. So that is going to be a really big step forward in terms of meeting or improving nutritional quality. But as I mentioned, we also know that there are still several counties where the cost of living is higher. And so there's still a gap that we need to fill. So filling that gap would be one way. Another area is strengthening the federal nutrition education program. SNAP Ed is what it's called. This provides SNAP participants with direct access to education that increases not only their knowledge, but also their shopping skills. So you can really work with that program to teach them how to purchase healthier items with the limited SNAP benefit as well. And currently SNAP Ed only reaches about 15% of participants. So that is one where we could certainly expand program reach and strengthen. The third area is related to promoting healthier foods and beverages in the retail environments where SNAP participants do their grocery shopping. So this would really help the retailers, encouraging them, providing incentives to stop and promote a more to stock and promote a more health promoting assortment of foods, ensuring that more retailers are authorized for online SNAP would all really help with the nutrition quality by increasing access. And as I mentioned earlier, as we've seen during the pandemic, it's been so important to be able to order food online, and promoting healthier purchase with SNAP benefits, including those online purchases, would be a really great area to explore. And then the fourth area is a little more broad. It's really fostering a much more resilient food system with an eye towards supporting stronger infrastructure and coordination around nutrition security before, during, and after emergencies. So hopefully we won't have another pandemic like this for quite some time, but there are plenty of other emergencies, natural disasters. We have disaster SNAP here in North Carolina because we frequently experience hurricanes and the impacts. So there will still always be a need for the program. And nutrition security is a bit different than food insecurity, I'll just flag, in that the focus is on more consistent access, availability, and affordability of foods and beverages that promote health and well-being. So really thinking through that lens, promoting sustainability and resiliency within the food system is going to have benefits for everybody, not just SNAP participants, but again, would really increase access to nutritious foods across the country.
Thanks, Megan. Another question that came in is, what are your thoughts on automatically enrolling in community eligibility provisions, schools and school districts serving areas that are chronically poor?
Yeah, so the community eligibility provision allows high poverty schools and districts to provide breakfast and lunch at no charge to all students. There are a lot of benefits of community eligibility. It really reduces administrative paperwork and cost, increases school meal participation, eliminates stigma for low-income children, maximizes federal reimbursement, and makes it easier to implement breakfast in the classroom and other innovative breakfast models in particular. So community eligibility, we have the data. It's a win for everyone. It helps administrators, students, families, school nutrition staff. But one thing to note, in an area where I think additional action is really needed, in July, we released a brief focused on improving access to free school meals, which looked at the intersections between universal free meal approaches, with community eligibility being one of them, and educational funding. And as I mentioned, while we know there are significant benefits to doing this, one thing to point out is that schools offering universal free meals are no longer required to collect free and reduced price meal applications. And that's great because that helps reduce that administrative burden. But this is also an important source of data on household income that has traditionally been used to allocate funding to schools. So for example, free and reduced price lunch applications are considered when allocating Title I funding. So it impacts other areas of educational funding. So one thing that's really important to pave the way for more schools to adopt universal free school meal provisions, or to adopt community eligibility in particular, is to really find ways to disentangle the free and reduced price meal application data from the education funding. There are other measures we could be using, and it's really having guidance from Congress or USDA or the Department of Education that would give schools more ideas on how to do that, because it's just a shift from how we've done it in the past. So recommendations to address these intersections include researching and developing alternative measures of poverty and economic well-being to allocate that education funding. And again, communicating those, we already have some that could work. And again, then addressing those misperceptions or misconceptions about the impacts of universal free meals on education funding through strong messaging with the districts, because a lot of schools are nervous that by going this route, they'll lose that education funding. And the point is, it doesn't have to be that way. We just need to communicate to them how to do it differently.
Yeah, that's great. The administrative burden is such an overlooked but important part of this. So I'm so happy that you've highlighted how we can help reduce that. And the stigma piece too is something that has shown up a lot. I see it even in my own kids' schools, and it's nice when that's it's just something that's universally offered, and there isn't any distinction between one kid and another. So another really important part of this in terms of uptake and utility. We have another question, and just want to remind the audience, if you have any others, feel free to raise your hand or press *9 and we can call on you. How does the infiltration of fast foodways in lower income areas affect what's included in SNAP benefits?
So SNAP benefits, as I mentioned earlier, a family, if you qualify for SNAP, you get a monthly allotment on an EBT card. There are not nutritional requirements in the same way there are with WIC. So with WIC, it's a very prescribed food package tailored to meet your life stage and or nutrition needs. With SNAP, it's a dollar amount. And the only limitations are you cannot purchase alcohol, tobacco, or hot prepared foods. So I think one way to think about this is if you're living in a low income area that is infiltrated with fast food options and less nutritious offerings, you then have some additional barriers to being even able to use your SNAP benefits at the first place, because you can't go use your SNAP benefits at a McDonald's. You can't go use them at a hot food bar, even at a grocery store. So how do I then have to tackle this transportation barrier of where is the closest grocery store? How am I going to get there? How much time is it going to take? And that's one reason, as I mentioned, that online retail expansion has been really great. And so we have to really think about it, living in communities where you have just this influx of less healthy options and a lack of full service grocery stores or a lack of fresh fruits and vegetables and other healthier options really does limit what you can then use your limited dollars for. And we also have data showing the healthier foods are often more expensive. So again, this is where going back to the Thrifty food plan, and the actual base benefit amount is just as important as what's available in that particular area. And then again, finally, I highlighted several ways in which we could, I think, incentivize retailers or work with retailers to improve the healthier food offerings. And even in small corner stores or gas stations or smaller markets in those communities, there are ways we can really incentivize those retailers to carry the healthier items, strengthening SNAP stocking requirements, really incentivizing or beefing up programs like the nutrition incentive program that exists to double dollars spent on fruits and vegetables, and thinking about how we also then incentivize the retailers for stocking those those healthier options are really important.
Yeah, another thing that would benefit everybody, not just those who are SNAP beneficiaries. Another question that's come in is, can you speak a little more about some of the creative responses you have heard of during the pandemic, how schools have managed to feed kids and families, or how the WIC and SNAP programs have changed for the better?
Yeah, so, I mentioned a little bit, those school meal programs, their staff were some of our frontline heroes in the very beginning, helping to get meals to kids who really needed them. And so we have examples around the country where school districts were actually using their school buses and their transportation staff to get meals to areas where families weren't able to come to distribution sites. And that was a really innovative means to bring meals, especially into more rural or lower income areas. There were also, along those lines, to address more rural areas, USDA worked with Baylor College in Texas to do this emergency meals to you box, where they were packaging a week's worth of meals in these boxes and mailing them to students' homes. And this school districts could then enroll through that program and serve their students that way. So that was another more innovative approach to getting foods to the children who really needed them. And then I mentioned already, there were distribution centers set up at schools and community centers, and really finding creative ways to package the meals so you could serve multiple days at a time were really important. And we have several case studies going into more details if people are interested in learning more, but those are just a couple of ways that people were really innovative in their approach. And then, I talked a little bit about that physical presence waiver and how important it was for WIC, and similarly, the electronic signature waiver for SNAP, and allowing some of these certifications to be done over the phone. Waiving these in-person requirements for some of the studies we looked at. So for example, looking at the New York data that I mentioned, where we were able to conduct a rapid response study to examine the patient satisfaction and preferences with regards to WIC virtual visits in particular, from July to October 2020. And waiving the in-person requirement for most appointments really supported participation in the WIC program. And I think I mentioned this earlier, but the no-show rate was reduced by 45%, which is so significant. We often have periods after a child's first birthday where we see a big drop in WIC enrollment, because it's harder for families as the child ages to make those visits. So this has potential, in my opinion, to have such a dramatic impact on long-term program participation beyond the pandemic. If we can find a way to make it easier for families to stay in the program and get the benefits they need, we're going to have such better positive outcomes when it comes to reduced healthcare costs and academic readiness and nutrition and diet quality and support. And WIC participants really reported that they thought these were high quality consultations over the phone. So also really important that they felt that what they were getting was not different from what they had been getting in person.
Excellent, Megan. Thank you. Well, we're coming to the close of our session together. This was really a wonderful, wonderful wealth of information. I want to extend a huge thank you to you, Megan, for the insights you shared with us today. A huge thank you to our audience for registering, for coming to learn some more, for submitting questions in advance and during this presentation. As we've seen during the COVID-19 pandemic and economic crisis, SNAP, WIC, school meals, and other critical nutrition policies really play a vital role in confronting food insecurity and ensuring healthier outcomes for families and communities. Many are forced to make impossible choices between purchasing food, meeting rent, and acquiring needed medication. To address these challenges, work must be done to improve nutrition assistance programs and policies, and we're privileged to continue partnering with organizations like Healthy Eating Research as we tackle these issues together. Thank you again to everyone who participated today. I appreciate your time and interest. We will send everyone a recording of this webinar with links to resources. Stay tuned for more information about future learning sessions, and we will be sending a brief anonymous survey about today's discussion, and we would really appreciate you completing it to help us plan for future events. Thank you so much for joining, and have a great day and rest of the week.